Hi, Dr. Shetlin with you this morning, and I'm interviewing John Roycroft, who has been to the Immunity Therapy Center in Tijuana, Mexico, and had some amazing results. So we wanted to get his story from beginning to end, the experiences that he's gone through. So John, I understand you came all the way over from the East Coast, flew into San Diego, and then went down to Tijuana for care. So tell us a little bit about yourself. Who you are, where you're from, what you do, and when you first discovered your cancer, and we'll go through some of those questions.
Okay, well, I'm John Roycroft, and I was first diagnosed with head and neck squamous cell carcinoma, HPV positive, and unknown primary, and that was in September of 2018. My wife, prior to that, was studying to be a personal trainer. And through her training and the modules and things that she was learning, she learned about alternative cancer treatments. And so we were looking into that, and we kind of joked with each other in a way. We said, if either one of us got cancer, that's the route we're going to go, because we learned too much about the way that people are treated here in America with the chemo and the high dose chemo and the radiation and all that. And we didn't want to go that way. I wanted a quality of life. And so I was diagnosed in September 2018. And so we immediately went into treatment with juicing. We started juicing and a good diet. I had a horrible diet. I had a stressful life, stressful job. Had some things in my life with, I had some bitterness with some things in my life. And so I'm a robotics, I work in robotics engineering for the Johns Hopkins University Applied Physics Lab in Laurel, Maryland. And so we started on the juicing. Then I went and had a PET scan done, had the biopsy, all that, and it confirmed the cancer. So we with the juicing and all that, then we decided to research doing alternative therapies. And through prayer and research, we decided on the Immunity Therapy Center in Tijuana, Mexico. And that's where we went.
Fantastic. So you first discovered it in 2018, and you started juicing, started working on some lifestyle changes, and even letting go of some stressors, because people don't realize how stress affects their immune system, and our immune system is fighting cancer every day. So here you had stress and poor diet, and who knows, other are the things that triggered, of course, but you addressed those first. And then what happened when you first went down to the ITC?
So we got to the Immunity Therapy Center in early November of 2018. We were apprehensive at first, not knowing what to expect. The first person we met was Gaston Larios. He's the customer service rep there, and he really helped. Excuse me. He really helped a lot with getting us settled, and getting us settled down, and letting us know what to expect. And when we got there, there was a lot of activity going on. They were pretty packed out, pretty busy with a lot of patients at the time. And but I started on the afternoon shift with Dr. Pablo Orozco, and we met with Dr. Bautista. The great thing about Dr. Bautista is he has this calming effect when he speaks to you, and he answers your questions, and he really makes you feel comfortable, gives you a great sense of confidence when you're there. So I went into this with confidence. I was very excited, oddly enough to say. I was excited to be able to do this, because the place there gave me this sense of confidence, and I knew that something great was going to happen there. I had that feeling.
Oh, that's awesome. Yeah, they do definitely. It's a humble place, but yet it really does instill confidence and hope, which unfortunately people start to lose hope sometimes when they hear that diagnosis and know that there's only one choice, when all of a sudden, like you've done your research and found there are other choices and more natural choices with better quality of life. So that's
right.
Glad you found that place. So then, so if you did some treatment, how long did you do treatment in 2018? And then what happened that brought you to 2020?
So in 2018, we stayed there for 6 weeks. and my cancer, I had a lump on the side of my neck, is how we first discovered that made us go into to look into the cancer. And the lump was obviously going down. And we decided after 6 weeks to leave, came home and had a PET scan done. The PET scan showed that the cancer was down 70% in just 6 weeks. So I decided, the clinic offered a take-home program. I decided to do the take-home program. I got some of the machines that they use there and a lot of the supplements and things, and decided to treat myself at home, hoping that I could finish off that last 30% to be cancer-free. Unfortunately, that didn't happen, although through the entire year in 2019, I finished the 3-month protocol that they gave me, still have the machines. Through my own research and contacting the clinic, I actually started some other protocols throughout the year. I was doing high-dose vitamin C, was doing a lot of different supplements, artemisinin, some other natural supplements. I did the cannabis oil into the fall. And then I noticed I had an RGCC test done in April of 2019. That showed some very good results. Although I did still have the cancer, it showed my circulating tumor count was down pretty low. So I felt that my cancer was still kind of going away, almost there. And then in the fall of 2019, I noticed some nodules on my neck, almost like acne. And I let that go for a few weeks, and then it kind of got a little bit worse. Let it go for a couple more weeks, and then all of a sudden I had a tumor start to come out the side of my neck. And that was kind of frightening at the time.
Yeah, I bet.
So then I still let that go because I was taking a product called fenbendazole, and I had started that in September, and I was on that for a number of weeks. That's another protocol, and it's a dog deworming medicine, and a lot of folks are having success with it, and I was hoping to have success. The reason I let the tumor go so far was because they say that sometimes a tumor will get a little bit larger before it starts to go away. Well, mine just kept getting larger, and it got to the point where it was quite a growth on the side of my neck. So my wife was talking to me, and we decided, this isn't good. But I was still kind of a little bit stubborn. So then all of a sudden I noticed I was off on from work on disability. I was taking the RSO cannabis oil as a treatment. And I was about 3/4 of the way through that protocol. And then all of a sudden I completely lost my appetite. I just had absolutely no appetite. And I'm a person, I always had a voracious appetite. And I noticed I was losing weight because I was off at work, and I noticed I just had no appetite. And I was always one of those types of people that felt that, well, just because you don't have an appetite, you can still eat the food, you just won't taste well. But I found that's not the case. Your body, when you try to put the food in, your body just rebels, and it says, you try one more bite and everything's going to come back up. So this went on for a few weeks, and I lost 20 pounds in about 3 weeks. I was down to a dangerously low weight for me. And finally my wife said, John, that should be it. Let's call the clinic. We had success there at the clinic the first time. Let's call them and see what they say. I called the clinic, talked to Gaston again, and this was on a Tuesday in first week of February of 2020. And by Saturday, he was able to get me in at the clinic. The ironic thing about this is I had no appetite, and we were looking at this as actually a sign from the Lord. Mm-hmm. And the reason is because I completely lost my appetite. We got plane tickets to come from Maryland to San Diego to get to the clinic, and we had a stopover in Denver. And when we stopped over in Denver, we had about an hour layover. And here I haven't eaten hardly literally anything I haven't eaten for the past week. I was just really bad off. And here I am sitting in the airport in Denver. And I told my wife, I'm kind of hungry. I'm going to be looking for something to eat. So I got up and walked and found a place that had some wraps. Went and got one, sat down, and I started to eat thinking, oh boy, here we go. This isn't going to work out well. And, but I ate and I got through the whole thing. And then about 10 minutes later, I said, you know, I'm still kind of hungry. And I went and got something else to eat, sat and ate it. And to make a long story short, we got to San Diego. We got to the clinic Saturday afternoon. They offered us lunch. I ate the whole lunch, and my appetite was back. And my wife and I, we looked at this as a sign from the Lord to say, he was telling me the only way that I would have stopped what I was doing at home to go and get this treatment done at the clinic. The only thing to do that was for him to take my appetite away completely. And that gave me the wake up call. And then when we got on the way to the clinic, for him to give me my appetite back in such a great way was our sign to say we're on the right path and God's leading us in the right way.
That's fantastic. Yeah. Sometimes we need a little nudge in the right direction. So that's fantastic. So then when you came back, you did treatments for 3 months, if I understand right?
Yes. So we were determined that because of the first time we came, we left early. Even though I was having success, obviously, we left. We thought it was financial reasons. We felt we needed to leave and I could treat myself. We were determined this time when we went back the second time that I wasn't going to leave until the cancer was gone. And I did what I could, cashed out retirement plan, got as much money together as I could to have some resources. And we were determined to come back to the clinic as long as it took to get the cancer to go away.
Gotcha. Well, I'm going to address this in a later interview, but I just want some of our listeners to realize that anytime you're fighting cancer, it's expensive. But the cost of doing it natural like you did and like my wife Shannon's doing, in comparison to the loss of quality of life and the system in America, it's small compared to that. And because when she went down there for a week and then stressed out because the COVID thing started and we had an earthquake at our home, and she's like, I need to be home with my family. So she came home after a week. And while she was here, she's like, I don't know if I can go back down there because with the COVID thing and going to another country. So she actually seriously looked into doing our model here, the gold standard of chemo and radiation. And, her insurance would cover 80% of it, but still just the copays alone were more expensive than 6 weeks of natural treatment down there.
Right.
Boosting our immune system naturally, returning the quality of life like you experienced versus taking you to the brink of death and hoping that you make it and come back. And that's where it's funny to me that unfortunately in America, sometimes we put away, we give up the power of our own health to somebody else, saying, if our insurance doesn't cover it, I can't afford it, rather than saying, well, what's important for me and my health and how am I going to invest in my health? So my hat's off to you that you guys just did what it took. That's awesome. So, and I hope that that's a good example for other people, because quality of life is more important than just quantity of life. To add a year or two to your life miserable, that's no fun.
Exactly. I joined a few different Facebook groups that dealt with natural cancer treatments. And then one of the Facebook groups that I stumbled on was head and neck cancer survivor support group. And I thought, oh, wow, this would be nice to. And when I joined the group and I started reading a lot of the posts, I quickly found out that this was not the group that I thought. What it turns out to be is people that survived the standard care of treatment that they use here in America, which is the radiation treatments. It's 35 radiation treatments, and it's multiple rounds of high dose chemo, and I was reading the stories in there, and within just a matter of minutes, I was in tears reading some of the stories of what these people went through, because head and neck cancer, they radiate the entire head, they radiate the entire neck area, and the side effects, even though the side effects the doctors tell you, because when I was first diagnosed, I met with a standard oncologist, I met with a standard radiation therapist, and they told me, well, you may have this side effect, you may have that side effect. No, I knew from experience from people that have gone through it that you will have these serious side effects. And these poor people, they're having their teeth removed, and they're losing their ability to swallow, and they're losing their ability to hear, and they're losing the ability to speak, and their mouth it's horrible. Many of them have to get permanent feeding tubes and to be able to eat for the rest of their life. And I thought, that is not going to be me. I don't want that. And I would be, and my wife, we prayed about this. We talked about this a lot. She was so supportive to understand that if it took selling everything we had for me to get better, to have a quality of life, that's what we were going to do. And she was totally on board with that. She wanted a husband that had this quality of life, that we could live together to a ripe old age and be healed of cancer, than someone who was maybe so bad off that, some folks have to have a substitute tongue put in, and these kind of things. And it's so sad. And I pray for these people, and I feel so bad for these folks, but unfortunately that's the only treatment that they know, because the standard care environment is they throw a fear into you, and they scare you, and they say, we've got to do this right away, we've got to get you on this radiation, we've got to. And I had a doctor, my ear, nose, and throat doctor I went to, told me, when I kind of made the mistake and told him early on that I want to treat my cancer holistically. And he just sat back on the counter, and he says, well, I don't know anyone that's ever been cured of this kind of cancer that way. And if you try to do that, you're going to die a slow and horrible death. Whoa. And this was my first meeting with a doctor, and he's telling me these things, and they try to put that fear into you so they can get you into the system right away, and get that chemo and get that radiation. And it's horrible. I've seen the aftermath. It's bad.
That's just so sad. And that's what happens all the time. I've been trying to interview an oncologist. I really, really respected my wife's oncologist, incredible bedside manner, a brilliant man, but still he only has one tool to sell, one widget in his toolbox. But in fairness, in this interview series, I want to interview a good oncologist to get their perspective, why they're still doing what they're doing after 70 years of epic failure in this model. And I've tried to get 3. I cannot get anybody to do an interview. So it's interesting.
Right. Now, ironically, this type of cancer that I have is documented to be successful with the radiation and the high dose chemo that they use. This particular cancer is successful using that, but the aftermath is incredible. As I told you, these poor folks have to live with the side effects that many it's terrible. And as I said, I wanted a quality of life. I wanted to be able to speak properly to my wife. I wanted to be able to kiss her. I wanted her to be able to look at me and not see a disfigured person. And so we decided to go this route, and praise the Lord, it's been successful.
That is so fantastic. Well, I hope I can interview you in the future too, see how things are progressing along. And I'm just really excited for you and your wife that you had such good success with this program. And just, I'm sure it's going to give hope to others that as you come across paths of other people that are having this struggle. It's just nice for them to bump into somebody's like, oh my gosh, you've given me hope, and there's other options out there. So right. What a blessing you'll be to some other people too. Well, in closing, do you have anything else you want to cover? Like, for example, how important is it to have a support system like your wife or other people that don't think you're crazy, not following the standard, gold standard? And what part did your faith play in this? It sounds like you prayerfully made this decision, so it sounds like it was an important part of your decision here.
Yes. Yeah, we have a very, very, a very good church that we attend here in Baltimore, and we've got tremendous amount of support there. Naturally, some folks, some families, some friends, when we first told them the route that we planned to go, we get some eyebrows raised and naturally a lot of questions, and had to answer many questions. But in the long run, everyone was very supportive. We had a lot of prayer warriors in that regard. As far as the caregiver goes, this is always tough for me to talk about because my wife has been my caregiver this whole time, and every time I talk about it, it kind of gets me choked up. But I wouldn't have made it through this without her, and her support. She's been with me even from the very beginning. It was her who first noticed the lump. It was her who had the training that she was going through to learn about holistic and alternative treatments for health, and especially for cancer. It was her that got involved with the Truth About Cancer and ordered some videos that we watched, and it was her that got me involved with watching documentaries, watching about Charlotte Gerson and the Gerson Institute, and watching other videos about natural cancer treatments and healing. It was her that throughout this whole time, she traveled to Mexico with me. She was there to be my caregiver, to pray for me, pray with me, to cook for me, to take care of me. Especially this last time when I was there with, I had surgery to get the rest of the cancer removed from my body, and she was there just to take care of me. It was great to see her too, to be able to be there at the clinic and be a spiritual and an emotional caregiver to others. She's a very selfless person, and she was able to pray with others and encourage others at the clinic. And she is a true blessing from the Lord to me.
Awesome. That's fantastic. Well, let me ask you one question, because in that religious state or in that faith state, how did you stay on course, faithfully working through it rather than getting angry at God or something? How does this happen? Because some people unfortunately go down that path. So how did you stay on that positive path?
I'll be honest with you. I had some ups and downs. I've been a born again Christian for over 30 years, and we've worked at my church. I've been a choir director. I've been a children's director. We've worked in children's ministries. We were folks that we thought, wow, we're serving the Lord in such capacity, and surely He's going to take care of us and make our life just be wonderful. But even through this journey, we did realize that when I got cancer, naturally you get that first punch in the gut. And, wow, oh my goodness, I don't know that I really said, why me? I don't think I ever was at that point, but certainly you've got that question of, oh my goodness. But then we quickly realized through our faith that we actually call this my blessed cancer, because it so turned our focus and our mind from it makes you really appreciate where you are at that time. And I realized the some bitterness that I had, and some angers and some issues that I had, and I had to quickly address those. I had to speak to people and ask for forgiveness from people for things that that I had some bitterness with, and it's such a cleansing and healing thing. And I'm sorry, I lost my train of thought. But when I was in Mexico, and we would have some great success. I was there this past time for 4 weeks, and my tumor was going way down. Great success, and then all of a sudden, we get some news. Well, this isn't quite where we would like it to be. This isn't, and then you get that feeling of, oh my goodness. And we didn't really question God, but there were these times where you're in the valley and you're thinking, oh, Lord, here so long, I felt like we're doing the right thing and you're leading us. Then all of a sudden you put this roadblock up. But there's in the book of Habakkuk, if you read the book of Habakkuk in 3 chapters, it's only 3 chapters. And it really, that helped us out to realize that God is, God doesn't owe us anything. And when you're able to come to that realization and just love God and love him for who he is, and realize that God is going to be God, and we need to love him on the mountaintops and in the valleys, and he will bring us through. And it was once we come to that realization, it really helped us to understand that, everything that he does for us, and things that happen, good or bad, is for our own good. And eventually, even though we don't see it as we go through the storm, we know that at the end of the storm, there's going to be a realization of, okay, now I know why. And it's for a better thing. It's for something else, for us either to help others or to make us a stronger Christian.
Right on. I love it. Yeah. Thanks for summing that up so beautifully. Thank you for taking the time to visit with us today. Do you have any other closing thoughts, or are we okay to wrap up right here?
No, I really appreciate the opportunity to be able to speak with you, and hopefully to try to be a blessing to others. God has revealed a lot of things to us through this journey. We've learned a lot of things from the clinic, a lot of my research and things that I've done with natural cancer, and we've been able to hopefully be a blessing to others at the clinic, and that's one of my main goals. Through this, I'm hoping that the Lord uses me to be able to be a blessing to others as they start this type of a journey with cancer.
Fantastic. Well, I hope that this video goes out to plenty of people. There's already been some people finding some of these videos and posting thank yous on YouTube, because they're struggling with these things and they're finally finding some uplifting direction. So thanks for being a part of that for others. All right. Thanks, John. Thanks for being with us today, and keep on doing a great job what you're doing.